Joining us here on the KAMR Local 4 News, the City of Amarillo is preparing to have a briefing about the coronavirus pandemic. We're taking you live now to this breaking news.
Today during his press conference at 2:30. I want to set your expectations that Amarillo is not, I do not believe, ready to begin to reopen. And it would not surprise me if you heard the governor address us specifically during his press conference about that. We're still seeing our numbers increase, and that makes it challenging. We need to see them plateau and decrease for a period of time before we really can begin the reopening conversation. So we're actually starting the conversation. We're starting to put framework around what that would look like, but actually implementing it cannot happen until our numbers plateau and begin to decrease. And I know it's getting hard. It's getting hard to be all in. It's getting hard to stay home. As I do this press conference around the corner, I have a child doing a ballet class for credit at school. And I have another child doing trombone sectionals for credit at school. So I know that being at home together is sometimes challenging, especially if you're a parent and you're trying to do your work, and or if you're a family that's not able to work right now and financially it's hard. But this is where we're building our character, Amarillo. We're staying in order to keep other people healthy. When we get these hot spots under control, then I believe our numbers will start to go down. And that's when we can begin to embrace what our new normal looks like. So what do we need from Amarillo citizens right now? And I want to be very clear about this. We need everyone who can stay home to stay home. And I've had a lot of people say that I'm not sure. Can I go to the grocery store more than once? Can I drive by my friend's house and wave? What all is allowed? Well, what we're asking is, if you can stay home, please stay home, because there are people that don't have the option of staying home in order for our city to operate and our food supply chains to operate. And we need to decrease the amount that we're out in order to keep them safe. So if you can stay home, we need you to stay home. If you have to get out, we need you to stay distanced at all times. Don't go into someone else's space, whether that's at a grocery store or at your job. We need you to stay distanced if you're out of your home. And then we need you to wear a mask. And while we have not made that a mandatory order that we're enforcing with fines in our city, Amarillo, I would hope we would not have to do that. Everyone has at home a bandana or a t-shirt they can cut up to create a mask. And yes, you're wearing it for yourself, but you're really wearing it for everyone else. So if you go out, I need you to wear a mask. And I'm asking that we as a city would choose that for ourselves. Not because of your constitutional right to do it or not do it, but because we love each other and because we are good neighbors. And so if you can, stay home. If you must go out, please physically distance yourself from everyone you come in contact with. And if you're out, please wear a mask, because you're doing it for someone else. You're doing it for your neighbors, not just for yourself. That's what I have this morning. Thank you.
Thank you, Mayor. Now I want to go to Casey Stoughton, Public Health Director, City of Amarillo.
Thank you, Dave. As of Sunday, there were a total of 505 cases of COVID-19 reported in Potter and Randall counties. We will have an updated number for you today on the 2:30 report card. We also have a total of 90 recoveries, and we are thrilled with each and every recovery in our community. We do have a total of 9 deaths reported for Potter and Randall counties. Please remember to wear your masks when you have to go outside your home, anytime you go outside your home. My mask protects you and your mask protects me. It is important to wear a mask anytime you're around others, including the grocery store, work, and any other places you may go. Right now, it is critical to protect one another. Wearing masks, hand washing, and staying home are the best ways to do so. Please do not go to work if you're experiencing symptoms, any symptoms related to COVID-19. If you're sick, please call your doctor and stay home unless you need to seek medical care. If you're experiencing symptoms of your chronic health condition, please reach out to your physician or your medical care provider. And if you are well, please consider donating blood with Coffee Memorial Blood Center. If you're in need of a COVID-19 test, if you are in need of COVID-19 testing, our drive-through testing that's provided through Amarillo Public Health and Texas Tech Health Science Center continues today until 3 p.m. Please call 378-6300 and our call takers will screen you and direct you to the testing. Thank you, Dave.
Thank you, Casey. Now I'm going to go with Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center.
Yes, good morning. Once again, I'd like everyone to practice social distancing, to continue to wear a mask if you have to be out in the community, and avoid congregating. Over the weekend, there were 8 more transfusions of convalescent plasma to give a total of 19 to the people here in the community at the hospitals. Clearly, we need to increase our local donors, but I think as Casey's alluding to, our pool of potential donors is increasing. So we hope to see that increasing this week. And then finally, I'd just like to briefly say, let's just kind of keep our mind on what the overall goal here is. The goal generally is obviously to decrease the cases in our community, which would decrease the number of deaths, and then to avoid overwhelming the capacities at the hospital. And I think everybody's working hard to avoid those things. And I'm in constant communication with the hospitals, and I'm in the hospitals on a daily basis, and also with other facilities in the community that can help decrease the burden to the rising number of cases. So we'll continue to be in discussions with those individuals and keep Amarillo safe. And thank you.
Thank you, Dr. Milton. Now I'm going to go with Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Hospital.
Good morning. So I know there were a lot of concerning numbers that kind of appeared over the weekend. So I wanted to give an update, at least at the status of Northwest. So right now, as this morning, we have 62 patients that are COVID related. So that includes 39 that are actual positives, as well as 23 that are persons under investigation. Now, the big thing is about 2/3 of our critical care beds are now occupied, and that's a moderate increase from where we have been. Part of the challenge and part of our concerns is these patients that are COVID related in the critical care beds are needing prolonged time in critical care. And even more, they're needing particularly labor intensive measures to either keep them off a ventilator or to try to minimize their time on the ventilator. So that's become much more labor intensive for our staff. Now, right now we have half of our available ventilators in use, which is a moderate increase from where we've been. 75% of those ventilators are related to COVID patients. So again, some very sick people in our ICUs related to this outbreak. The mayor talked about some of these hotspots, and including some of the meat processing plants, and then also the Texas Department of Criminal Justice facility. And these are obviously vulnerable populations, just given the nature of that facility. Over the last week, we've had 37 positives, 30 of which came from one of those facilities. So we are seeing that we're an influx of patients coming from those vulnerable populations. Now, as Northwest, as with the other hospitals, has gained the ability to do in-house testing. Now, that being said, it's on a very limited basis, and we do not have assurance that we will get a constant supply of these tests. So we've done 52 in-house tests so far, 24 of which were positive in the patients that we tested. But we'd love to increase that more, but right now we're still waiting to see how steady of a stream of testing modules we'll get for those tests. I think I really appreciate the mayor hosting that physician roundtable at the end of last week, and something that came out again, which is people are not seeking care for all the other problems that they have. And Casey mentioned that too. Please, seek the care you need for those other chronic medical problems. If you're having particular problems or noticing that your health is deteriorating, if you don't want to come to the hospital, go to urgent care, go to your primary care. There's the freestanding emergency rooms. We have 2, one in Hillside and one in Georgia, where people can tend to go in there pretty quickly and get out in a reasonable amount of time if you don't want to come to the main ED. So please seek care. And the last thing is, this last weekend, I saw some of the home improvement centers and large retailers were as busy as I've ever seen them. And I would say that the majority of people in those places were not wearing masks. please take this seriously. I mean, I would love to assure that anytime a person comes to this hospital, we will have a critical care bed for them or a bed on one of our wards. And I cannot assure that, knowing that we still are facing a surge in this community. So please take care of each other. Wear your mask when you go out in public. Thank you.
Thank you, Dr. Weiss. Now I want to go to City Manager Jared Miller.
Thank you, Dave. From a public safety standpoint, Amarillo calls for service, Amarillo Police calls for service are down 3% versus this time last year. Amarillo Fire Department calls for service are down 32% versus this time last year. And ambulance calls for service are down 31% from this time last year. So again, showing reduced mobility, reduced activity, which indicates that people are taking the guidance of the Public Health Authority seriously. So we appreciate that. Thank you for that. With the exception of one day last week, calls for service for police have been down for this entire period. Same with fire and ambulance services. So just wanted to say how much we appreciate that. Ask everyone to be very safe and aware and cognizant of the other people around them. Help keep people safe. AmarilloAlerts.com, as a reminder, the city recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. Just want to encourage citizens to sign up for this service at AmarilloAlerts.com so that you can stay informed. As of this morning, we have 4,895 people signed up for these alerts. So thank you for doing that. Really ask you to keep doing that. Our testing center. I want to remind everyone that the drive-through testing center is still open. If you feel sick or if you have symptoms you think maybe COVID-19, call the public health hotline at 378-6300 to be screened for the drive-through testing center. That's still going to be open, and the testing center is connected in real time to the call takers. So when someone calls into the call center and has symptoms consistent or justifying a test that warrant a test, they will put that name into the system. It immediately shows up at the testing center, and you can go straight there and get tested. The pet pantry. While our pet pantry continues to be successful in providing help, on Thursday we had to close it early due to traffic safety concerns. We still have plenty of food to give away, courtesy of Merit Pet Care, who has graciously donated the food for this project. Really can't say enough how much we appreciate the help and support of Merit Pet Care making this possible. The pet pantry will be open again tomorrow, with modifications implemented to help ensure the safety of those participating in the pet pantry. Specifically, the pet pantry is going to move to Thompson Park. Those interested in obtaining food for their pets should enter Thompson Park from Northwest 24th. You're going to turn right there next to Wonderland, and then you're going to make a left on Chaparral once you turn into the park. So once on Chaparral, just follow the posted signs and enter the pet pantry drive-through line. Really, there's going to be signage on Northwest 24th as well. So if you turn on to Northwest 24th, right after you go across the highway, you're going to see the signage directing you where to go. Finally, an update on state executive orders. Under the governor's order GA-16, until April 30th, customers may not go into any non-essential retail business per guidance issued by the Department of State Health Services, or the DSHS. However, customers may continue to purchase items from non-essential retail businesses for pickup, delivery by mail, or delivery to the customer's doorstep per guidance, again, issued by DSHS. The DSHS guidelines also require all employees inside non-essential retail businesses to be wearing a mask. To see the guidance and more information, please visit dshs.texas.gov/coronavirus. The governor's indicated he does not expect the current GA-16 order to be extended in its current form. Therefore, it's likely that it will be modified between now and its expiration. We'll provide more updates as soon as we know more. We expect to know more today. So as soon as we hear more from the governor, we'll pass that on. That's all I have.
Thank you, Jared. Now I want to go to our media members where they can ask questions of individual panel members or the panel as a whole, as the case may be. Let me go ahead and start at this time with, if I'm correct, we have Roger Gray from KVII Channel 7. How are you, Roger?
I'm good. Hey, guys. Mayor and City Manager, we the updated disaster declaration seems like some very sensible precautions for the city. We talked Friday about the problems with the JBS plant up north. It now has 159 cases, and Moore County is the fastest growing as far as infection rate county in the state of Texas. Among the regulations in order are regulating ingress and egress from the city. Has there been any more discussion about at the very least trying to regulate the folks who are loading up and heading up to the plant from Amarillo.
Jared, you're mute.
Thank you, Mayor.
And I'll answer it while Jared's thinking about that. I have a tremendous amount of compassion for all of those people that are going to work those jobs and for their families that are coming home. And I have compassion for people who are encountering them in the course of doing essential things in our city. So I definitely want to know that we're helping them to make good choices, and that the choices they have to make are the available choices are the good ones that we need them to be making for their own personal safety and also to control the hot spots. So I appreciated your question last week, and I think Jared has some follow-up on some action steps that, at least we did some investigating after your question last week.
Sure, we're continuing to work with the governor's office, with DSHS. I know that the state has a lot of personnel up in Moore County that are working on the situation right now. We're going to continue working with JVS and with the governor's office and DSHS to make sure that they're being as safe as they can possibly be, including their transportation.
But no actual steps planned yet.
Working with them. There's no there is no plan in place right now to restrict them from coming into the city or from leaving the city.
And just pause for just a second, Roger, and think about all of the complexities involved there. How would we police that? How would we enforce that? There are folks on here from Moore County for various medical things. So just, it begins to be very complicated to highlight putting any travel restrictions across county lines because we are such a regional hub for people. And I recognize that's the reason to do it, but there are so many people that depend on needing to come here for other things. And we're just not equipped to set up borders at our city and to control travel from regional, small town, regional travel. So what we need are for business owners to cooperate with us and to keep their employees' safety in mind. And so, apparently that business had provided additional buses, and for whatever reason, employees weren't using them. So there was a breakdown in communication. So we did reach out, we did communicate. They told us they were going to communicate better to employees. So a lot of this is just a day by day, how can we do it better situation. And what we don't want to do is overreact as a government. And there will be people that already believe that we have. So we're looking for that targeted spot of keeping people safe. And we're really relying on business owners and individuals to step up and to do what's best for our neighbors, to do what's best for our city, and to step up their own personal responsibility so that they're making sure they're staying distant and they're wearing masks. Those are the two most important things.
So any regulation of that is going to be self-regulated for the time being, even though we know where they get picked up and know where the buses are and that the buses aren't being used, et cetera.
Yes.
Okay. That's all I have.
Roger? Okay. Thank you, Roger. This time now, if I'm not mistaken, we want to go to Jack Kessler of KAMR Channel 4. Jack, how are you?
Good, you?
Pretty good.
This first question is for Dr. Milton. We're hearing from local doctors and the New York Times that New York is the 5th fastest growing city for COVID cases in the U.S. Are we doubling our amount of cases every few days? Is this true? What are your thoughts?
Yes, I saw the graph of that. I guess it was an article out of the New York Times. And we are not doubling every few days. I think last week, and Casey can correct me if this is true, last week we had over 300 cases, and this week we have about 500 as of yesterday, and we're counting today. So right there, that doubling time is more than a week. Certainly, we'd like to extend that further and faster, and that's what we're working on doing. But I think that that table in that New York Times graph mentioned Amarillo at 4.5 days. And, I think that that's relatively older data. When this first started, that first Monday, I think we went from 10 to 30 within a few days. And so, that's tripling in 2 days. So anyway, as time goes on, these numbers are extending out and we are not doubling near as fast.
And then another question I have for you, Dr. Milton, is we saw on CNN that 30 to 40% of Hispanics tested have the needed antibodies. Are we possibly seeing that here?
So the question again was what? That Hispanics have increased antibody prevalence? Is that what you're saying?
Yeah, 30 to 40% of Hispanics tested have the needed antibodies. Are we seeing that here?
Well, so we're not. We're starting to do some antibody screening in the community and through private physicians, and also there's a study that's starting through Texas Tech where we're trying to learn about the prevalence of exposure in the community. I think that's maybe what you're asking. That's kind of a double-edged sword when you start stating that there's a increased certain population of individuals that may be more risky of contracting this. So to answer your question, we don't have those numbers here in the community. I think, relatively speaking, as a general population, the percentage is low and probably very low. But once again, we remain concerned about minorities because for many different reasons that they, I think, are at increased risk of not only contracting this, but having complications of that.
Thank you, Dr. Milton. This next question is for Dr. Weiss. How concerning is the increase in the use of critical care beds over the past 2 weeks?
I think it's very concerning. It is, particularly because these are not patients that go into the critical care unit for 2 or 3 days. They're on average, most of these patients are going 7 to 10 days in the critical care facility. So that's the problem. Is we are constantly working on how can we increase that capacity, not only in terms of just beds, but staff that can take care of those patients who are critically care trained. So it's a challenge right now. We think that is still our biggest vulnerability at the moment.
Thank you, Dr. Weiss. This next question is for Jared Miller. Local meatpacking plants are closing across the nation. Are any local meatpacking plants closing here?
None have closed yet.
And will the Panhandle experience a meat shortage like some places are experiencing here in the United States?
We don't have any indication of that yet. We do know that the meatpacking plants that we have in the Panhandle represent a significant portion or a significant percentage of the country's capacity. But I'm not aware of any shortages that we're experiencing at this time.
And then are any other plants becoming hotspots?
Other than what we've already discussed, no.
Okay. I have no further questions. Thank you.
Thank you, Jack. We now want to go to
We'll continue with the coronavirus coverage on air and online, and to keep up with the latest, you can visit our website at myhighplains.com. For now, let's go and send it back to programming.
And then we talked about Amarillo being 2 weeks behind, but are we 2 weeks behind the state, or are we 2 weeks behind someone else? Who are we 2 weeks behind?
I'll jump in. Well, go ahead, Dr. Miller.
Yeah, I was going to say we're probably 2 weeks behind everyone else, which would be generally the state, and certainly, several weeks behind other areas that like on the eastern seaboard.
And I was just going to say that data, I was the one that kind of started with that data point, and it was based on, we were 2 weeks behind in having our first positive test result from the state of Texas. So that's where that 2 week gap came from in my data.
Thank you. And then for Dr. Weiss, do we know how much of the hospital capacity is being used by either state prisoners or is JBS related?
Not exactly. I would say that over the last 3 to 4 days, in terms of just monitoring the positives we've been getting, 3 out of 4 positives were coming from one of those facilities, and these are mostly inpatients and ICU patients. So I would say, in terms of our total number of COVID positive patients, the majority of them are coming from one of those hotspots.
I could just add that I think as of this morning, there were 12 patients from the Correctional Institute from Clements, and about 10 of those were COVID related.
And then for the inmates, do they get a separate batch of tests for them, or are they in the same kind of batch as everyone else as far as numbers of testing? Do they get their own tests, or is it the same as ours?
Yeah, honestly, I don't think they're, maybe Dr. Miller can tell me, I'm not sure if they're doing testing at the correctional facility itself. I mean, certainly when they come to the hospital, we test them immediately, just like we would anyone else that is under suspicion for COVID.
Yeah, I don't think I have much more to add to that. I think that they're making every effort at that facility to cohort patients that may be symptomatic, and they're doing I think a fairly good job of trying to minimize transmission in that facility in general.
Which is why I think it's important to note too that anytime you bring groups of people together, the risk increases. And so we have to wear masks, we have to stay 6 feet apart, and as often as you can stay home, especially if you're sick. You just can't go to work if you're sick, because anytime you bring groups of people together, that risk increases.
Perfect. And then Casey, did you happen to have the latest 3 ages for the last 3 deaths?
I think it's as we move forward with the numbers of cases, I'm going to be able to give you a range. And so right now our range is 49 to 96 years of age.
Perfect. And then last question for Dr. Weiss. I remember last week you mentioned you were using that arthritis medicine. I can't pronounce that name, but what kinds of improvements or not improvements have you seen from using that?
It's hard to tell. We're doing a lot of interventions, and really we're focusing on the most critically ill patients. And so on those I'd say we're really moved a bit from hydroxychloroquine. So the data there is just not convincing that, particularly in critically ill patients, is a benefit. It seems that if it is a benefit, it's probably in people who are slightly to moderately ill. So we're really moving to more doing like plasmapheresis, which is an attempt to try to clear the blood of a lot of those cytokines, those chemicals that there are markers of inflammation. And then as Dr. Milton, the convalescent serum is really a key intervention there. So that has proven to be a real benefit in terms of reducing fever, reducing the inflammatory markers, that really seems to be part of this cytokine storm that makes these people so critically ill. So we've moved away from the medicine somewhat and moving more toward these other interventions that are now showing some promise.
Perfect. Thank you. That's all I have.
Thank you, Ariana. All right, I want to go to David Gay of the Amarillo Globe News. David, how are you?
Good. I'm good. Good morning, everybody. My first question is for Dr. Milton. You talked about 19 total plasma transfusions and the increased need for local donors. Is it still the only? I believe, and please correct me if I'm wrong, there have been 2 local donors. Have there been any more?
There have not been any more, no. But we're hoping that should increase this week as the pool is increasing.
Okay, fantastic. Thank you for the clarification. And I guess the next question that I have is for both Dr. Melton and Dr. Weiss. With the city council meeting coming tomorrow about the disaster declaration, and things could change between now and then. But I mean, if right now, what would your recommendation be to the city council about this disaster declaration?
Well, I think it would be to continue to follow the data and watch the number of new cases that are coming through on a daily basis. And it's a little too early at this point to relieve some of these restrictions. In other words, continue the same for now.
Yeah, I agree. I think Mayor Nelson said it right up front is right now the numbers are still not telling us that we can back off too much on these precautions, and particularly since we're just continuing to see a rise in our numbers. And if you look at other spots in the country, they want to see 14 days of declining numbers before they really start pulling off some of these restrictions. So we're still on the wrong side of the curve right now, I think.
Absolutely, absolutely. And the last question that I have, I guess, is for everybody or whoever wants to answer. Well, I mean, what would you say? Mayor Nelson mentioned this, about masks. What would you say to a person who was either skeptical or hesitant about wearing a mask in public during this pandemic, or adamant against wearing a mask in this pandemic?
I would say that it's fairly clear that individuals can transmit this virus and not have symptoms. So the mask is not so much to protect you, but to protect the citizens in your community, especially those that would be most at risk of having a bad complication from this.
I would add on that it's the thing to do as a good citizen, and that it is uncomfortable. I want to acknowledge right up front that there's something psychological about it. I was in a grocery store last week, and I was one of very few people wearing a mask. And I felt odd and stared at and uncomfortable. And I've heard other friends mention that they were the only ones wearing a mask, and that socially it felt very strange to them. So of course that gives me concern to hear that people as a majority are not choosing to wear a mask. It makes me confused. I don't understand why. Maybe we haven't done a good job of talking about what the masks are for, that they're for other people more than they're for you. Because I know as a society, as a community here, we're very unselfish. We are very much others oriented. And so wearing a mask is right in vein with who we are culturally about being considerate and thoughtful of the other person, especially that other person's medical concerns. The disease may affect them much more severely than it might affect you. So if just because you feel safe about getting the disease, you're wearing the mask for someone else whose health condition might not be as strong or as positive as yours. So I just think it is about thinking about other people. It is about pushing outside of our comfort zones. Number one, the physical discomfort of having your face covered is temporary. You're just going to do that while you're out. You're only out an hour or two probably. And then the psychological discomfort of thinking, I can't believe this is a reality, because the truth is the longer this goes on, the more real it becomes to all of us. And I recognize that, but I'm asking that each one of you would consider others as you leave your homes to take care of essential business. Please cover your face. You're not doing it for you. You're doing it for your neighbor.
That's all. Sorry.
I want to thank the mayor for those comments, because I think it's very easy for us to say, well, I'm strong or it's not going to affect me. But in the hospital here, we are seeing children who have cancer in the hospital here who are now COVID positive. And that's a problem. We've got to look out for each other. You don't know if that person standing next to you has the same fortitude that you might have in resisting this virus. And so, I mean, we love our siblings, we love our spouses, our kids, our grandkids. We need to protect all of them. And the only way we can do that is put up that barrier, because you don't know who's going to be affected by it.
And not to belabor the point too much or spend too much time answering this question, but we have guidance from the president's office. We have guidance from the CDC. We have guidance from both doctors on this panel right now, plus the state, the medical director for DSHS and the advisor to the governor to wear a mask. It's a recommendation. It's not a mandate. You don't have to. What you're doing is, it's not a compliance issue. It's a taking care of your neighbor's issue. It's a giving people a peace of mind that you're not going to negatively affect them. So to an extent, it's a leadership tool. And as the mayor said, it is uncomfortable or awkward to be the only one out there or one of few out there. And maybe people are looking at you thinking that you're paranoid. That's not what it is. I wore a mask this weekend out picking up some supplies, And it's because I want to take care of the people around me. And I think that's the approach that we all should take. Every single medical professional on this panel right here has said the same thing. Recommendation is to wear a mask. Obviously, it's not a guideline, it's not a requirement. But I think we're taking care of our neighbors when we're doing that.
And I want to add one other comment to that. I just want to say, as a guy that wears a mask, and I've done this, obviously in the hospital, I go into patients' rooms many times, have to wear masks. So if you just do it and start doing it, it's not that bad. It's not that you'll get used to it. It's not that bad.
And I want to make a plea to business owners. While we at the city have not made it mandatory to wear a mask if you're out and about, I would ask that you would require your employees to wear a mask. And I know some people are saying, but I don't have access to supplies for masks. And a homemade mask is better than no mask. And even if that's just a bandana tied around and worn up over your nose, I've seen some people wearing them under your nose. Please don't wear them under your nose. It needs to cover your nose and your mouth. So wearing even a bandana or a piece of cloth or, a kitchen towel that's been cut so that it can fit your face properly. Please, as a business owner, if I'm going into your store as a customer, I want to see that your employees are wearing masks. And so I know that is one more thing that we're asking you to handle, but I don't feel like it's too much to ask. Number one, the effect of it is proven and it will save lives. And number two, just because you can't order it from a supplier doesn't mean that you can't figure out a way for your employees to have their faces covered. So I'm asking every business owner whose business is allowed to be open right now, out of that situation, would you please require your employees to wear masks?
All right. Well, that's all I have. Thank you all for your thoughts. Thank you, Dave.
Thank you, David. That concludes our news conference for today. Once again, we do these every Monday, Wednesday, and Friday at 11 a.m. here on the City Facebook page. We want to thank our panelists for today for taking the time to join us and providing this information to the community. Once again, this is David Henry. I'm the Communications Manager for the City of Amarillo. And thank everyone for participating. Thank you.
Thank you.